My name is Nakia Clark, and I'm the Senior Community Outreach and Engagement Manager at Roswell Park. Welcome to another episode of our on-demand videos hosted by our Center for Translational Research on Cannabis and Cancer. As many of you know, New York State legalized cannabis for recreational adult use in 2021, and we hope to quickly delve into some of the ins and outs of what this new law means for you and your loved ones as you navigate the cannabis landscape. At Roswell Park, we have a group of dedicated experts who are leading the charge on scientific evidence and research as it relates to cancer prevention, care, and public health. Thank you for joining me today. How are you?
Good, how are you?
In this video, we're going to take a look at medical cannabis for providers. As a reminder, medical cannabis was legalized in New York State in 2015. As always, I've got a great guest here to answer your questions, and joining me is Dr. Amy Case. Welcome, Amy. How are you?
Good, how are you?
Let's get into some of the top questions. So there seems to be an increase in the use of medical cannabis without very many randomized clinical trials. Can you answer, why is that?
As a cannabis researcher, I can tell you that it is challenging to study cannabis, especially in humans, because cannabis is still considered federally illegal and it's a Schedule I drug. And so there is a lot of regulation that prevents researchers from studying it. However, there are actually a decent amount of randomized controlled trials, which are high level evidence. However, I'd say the majority of trials out there are more observational and not randomized. And so the products that are used tend to vary, and it's hard to compare study to study because often we're comparing apples to oranges as far as dosing and products.
Okay, and what are some of the symptoms that cannabis can treat?
So there are a decent amount of studies looking at cannabis in pain, mostly in non-cancer pain. However, there are some in cancer pain. And so the majority of those studies are mixed. Some of them are finding that there is benefit, and others are finding that there's not benefit. The number needed to treat for chronic pain, according to a Cochrane database review, is 11. 11 patients need to be treated in order to see a benefit. But there are other studies that support the use for chemotherapy-induced nausea and vomiting. There's some studies that show that it can improve appetite. And there's a limited amount of studies that show benefit for other things like sleep or anxiety and mood. And so I think those other symptoms have been looked at. However, there's mixed evidence there.
Now, when we talk about benefit, we also have to talk about the risk. So what are some of the risks associated with medical cannabis?
So there's a few things I talk about with patients as far as when I worry when they're taking cannabis that we need to make sure. One is a history of cardiac disease. And so anybody who has a prior history of heart attack, stroke, or atrial fibrillation, cannabis can make the heart rate go up. And so especially in the smoked product form, if someone ingests that, they can have a high heart rate. And so that is something we talk to them about. And we may want to avoid cannabis in somebody with that history. And the other thing, a big one, is their psychiatric history. So if they have a history of paranoia, schizophrenia, or bipolar disease where they had been on medication for that in the past or been treated for that, cannabis may bring that out. And so we try to warn patients, if they have a history, to be really cautious with using cannabis. Those are the two main ones. Driving under the influence of cannabis is something that we talk to people about. And then also combining cannabis with other sedating medications such as alcohol, benzodiazepines, and opioids, which can be sedating to people, and when you combine them together, can lead to adverse outcomes.
And that leads me into my next question about the drug interactions that you need to be aware of when prescribing medical cannabis.
So medical cannabis suppresses the immune system. And so one of the main things you need to know if you're a cancer patient and you're on immunotherapy, which the goal of immunotherapy is to rev up the immune system to fight the cancer, because cannabis has been known to suppress the immune system, there is a few studies that have shown so far that cannabis can actually decrease survival in patients and decrease how immunotherapy works in the body. And so there is a drug interaction between immunotherapy and cannabis, and people who are taking immunotherapy should should probably avoid cannabis at this time. There's other drug interactions. Coumadin is a blood thinner, so cannabis can make the blood thinner and raise INR values. And cannabis also can lessen the effectiveness of drugs like tamoxifen or imatinib, which is Gleevec, then another drug that's used to treat cancer. And so we have to be careful that we look like any other drug. Cannabis is a drug that is metabolized by the P450 system. So we need to be careful when a patient is using cannabis, when we prescribe certain drugs for them, that there could be an interaction.
Okay, now when providers want to certify their patients for cannabis use, what is that process like, and what training do they need to be able to certify their patients?
So in order to be trained on how to certify a patient for medical cannabis, I would advise someone, a provider, to go to the Office for Cannabis Management website, which is online, and there's some training materials there. And then once you take those trainings and pass the exam, you can then certify patients on yourself to go to the dispensaries and pick up the products. And there's a process in place for that where patients, there's a website and a registry where you need to enter demographic information. The provider goes on to the Office of Cannabis Management website and you input that information. Then we school the patient on adverse effects, the risks, and then Office of Cannabis Management then will mail the patient a card, and they take that card, which has their certification number, and they bring that to a dispensary, not a pharmacy. And so I think there are misconceptions about where to purchase this product. It is purchased at a special dispensary that distributes a menu list of different types of products that are inhaled, oral, powders, vaporizers, and several different ways that you can take that product.
Thank you, Dr. Case, and thank you for watching. If you would like more information on cannabis and cannabis research, please visit our website at roswellpark.org/cannabisresearch. Have a great day.